Hello, everyone. Welcome to this short video which will outline the new process change here in Manitoba for accessing immunoglobulin therapy, both IVIG and subcutaneous immunoglobulin. This is a shared collaborative effort between Best Blood Manitoba, Choosing Wisely Manitoba, and Shared Health. And part of this process is part two of our ongoing stewardship program here in Manitoba, looking at improving the use of blood components and plasma proteins. With IVIG and SCIG, we are hoping to ensure that patients who continue to need this valuable resource are able to access it, and part of the process will be ensuring that the right diagnosis, the right dose, and right duration is being ordered for all these patients. These are the key members of our project team, and my name is Arjuna Panampam. I'm a transfusion medicine physician and hematologist, both with Shared Health and Cancer Care Manitoba. We have membership here from Blood Management Services, as well as Choosing Wisely Manitoba. If you do have any questions related to this project, please feel free to reach out to any of these members, and we'll be happy to troubleshoot any issues that you'll be having as we transition to this new process at the end of 2020. Now, part of the reason we're undertaking this is historically Manitoba tends to be a very high per capita user of both IVIG and SCIG. And we're also seeing yearly annual growth that's quite high and appears to be unsustainable for the long term. The other reason we're engaging in this project is potential shortages in immunoglobulin product related to decreased donors during the COVID-19 pandemic. And since this is a potential shortage that may manifest in the next few months, the IVIG SCIG process change will try to ensure that those patients who really do need the product are able to access it, and that's part of the rationale for introducing this new screening process. A lot of the resources related to this practice change can be found at bestbloodmanitoba.ca, and there you'll find the immunoglobulin criteria for clinical use, which is a guideline for various indications for its use. We also have a clinical practice change document that outlines how this process is being deployed, including also an IVIG dose calculator. We're recommending that an ideal body weight be used when ordering immunoglobulin replacement or for autoimmune conditions. And then the checklist for the provider documents, which I'll go over. So please familiarize yourself with the guideline that we're using as a reference document. This is a document that was developed by content experts in different disciplines across the 3 provinces. And this was finalized in April of 2018. And it outlines the various indications for which IVIG or SCIG is indicated, and for those where there's no data. And it also outlines indications where the data is ambiguous and in some cases may be appropriate to use. And so you can find this document on the Best Blood Manitoba website, and please familiarize yourselves with the particular indications that apply to your patients. This is a screenshot of the dose calculator, which can also be found at the bestbloodmanitoba.ca website. This essentially will allow you to calculate the ideal body weight and then recommend the appropriate dosing for your patient's indication, whether it's a dose that's dosed as 1 gram per kilo or 0.5 or even 2 grams per kilo. The ideal body weight is recommended for most indications, and when requests come into the blood bank, it will be the blood bank will also do their own calculation to ensure that the dose being requested is the same as what would be calculated from ideal body weight. This is a snapshot of the revamped request for release for immunoglobulin, and it also includes other products. I just want to highlight in the orange boxes the areas that are pertinent to the immunoglobulin access. The top box, it identifies the sort of demographics as well as the clinical indication that it's being requested for, whether it's immune replacement for immune deficiency or for treatment of neurological conditions or autoimmune conditions. And the orange box below it highlights some of the key information that will be required so that we can screen people. And this includes the height and weight, so the calculation of the ideal body weight can be determined, and also the request dose for grams per kilo. We're also requesting that you tell us an estimate of the dosing schema over the next 6 months. For example, if you needed the dose of 50 grams over 2 days, repeated every 6 weeks or every 4 weeks. Every patient's a bit different, and we're hoping you can document the dosing schema for your patients. And then also the current dose requested for the infusion that the patient is coming in for. The other thing that we're requesting is attached to this is a prescriber document or a clinic note, which contains all the necessary information regarding alternate therapies that have been tried, any adverse reactions to immunoglobulin therapy, and I will show you the details we're requesting in a separate slide. Once a patient has been approved for immunoglobulin therapy, whether it's VIG or SCIG, the approval will be in place for 6 months, and then at the 6-month mark, a new document in terms of a prescriber document must be submitted with this request for release to demonstrate ongoing need for continued replacement. This is a document that can also be found on the Best Blood Manitoba website. It outlines the ordering process. Please also familiarize yourself with this. It identifies on item 4 the necessary information we're asking for in the prescriber document. So we're hoping that when an order comes in for immunoglobulin, that it also attached is a clinic note or some type of templated document from your area which identifies the diagnosis, the current indication for immunoglobulin use, if alternatives have been tried, documentation of the current height and weight, and if the lowest effective dose of immunoglobulin required is requested, and also some documentation of the expected duration of therapy and the clinical response to therapy. We're also hoping you can identify adverse events in these documents so we can monitor our patients. When this prescriber document or clinic note or templated document comes with the request for release, it will be screened by the transfusion medicine service, which includes both the technologist and the physician who's covering that data. There are essentially 2 processes, one for the inpatient setting and one for the outpatient setting. They're essentially identical in terms of the necessary documents that are required. So you need a request for release and a prescriber document. The only difference is that inpatient requests are screened urgently because of the urgency of the indications. And essentially, once the document comes into the blood bank, the lab will review it based on the guidelines that we talked about. And if it matches a green listed guideline, then the product is issued. If it matches an indication that is either ambiguous in terms of evidence or is not recommended, then the document and the request has to be approved by the transfusion medicine physician on call. The physician would review the request and determine if it's appropriate and let the blood bank know. And then once the blood bank has an idea of if it's been approved, the lab will issue the product. We realize there is sometimes urgency in accessing immunoglobulin therapy for inpatients, and as such, if there are concerns about delay in accessing product, and the transfusion medicine physician is always available through your local paging service to answer any questions and expedite the access if appropriate. The outpatient setting is essentially the same as well. The only difference is that all the outpatient requests are screened by the transfusion medicine physician every 6 months to ensure that the request continues to be appropriate. And so the stepwise, what would happen is the ordering physician would send a request for release with the prescriber document to the lab. You can send this in advance if you know when the patient is coming in, so then these documents can be screened appropriately. The requests are forwarded to the transfusion medicine service, which will review the request and determine if dosage is appropriate. And then if it's approved, then it's communicated to the lab, and the lab will issue the product. If there is some ambiguity in the indication or the dose is not appropriate, then the transfusion medicine physician or the lab will communicate to the clinic or to the ordering service to determine if additional information is required. And once that's done, then an approval is communicated to the blood bank, and the blood bank will issue the product. So essentially, the process is the same for the inpatient and outpatient. It's just that the inpatient setting, the on-call physician can be involved if requests are urgent. So some process details to consider. You may want to consider sending outpatient requests in advance to allow time for screening. Since this is a new process, we will be screening them as we receive them, but ideally this will be screened at least 1 to 2 times a week. It is necessary that on the initial request for immunoglobulin therapy that a prescriber document or clinic note or some templated document is sent. And then every 6 months, if there's continued need for it, it should be sent again. The necessary information was identified in the prior documents. Patients on ongoing therapy, we are recommending that they be reassessed every 6 months, and documentation of efficacy and determine if ongoing treatment is needed, as well as if there are any side effects. If there's a significant difference in the ordering dose versus the calculated based on the ideal body weight, the blood bank will adjust the dose, document that in some fashion, and communicate it to the clinical service based on the ideal body weight calculated. And we're requesting that patients who are on indefinite therapy, that every 6 months some form of reevaluation is done, and this is also submitted to the blood bank so that we can review if the ongoing need for it is appropriate. Once again, if immediate approval is required, the transfusion medicine physician on call will be available to expedite access to the immunoglobulin therapy. Prescriber notes or clinic notes or templated notes that are missing key information will cause delay in accessing this, and the blood bank will notify the ordering service of which information is missing. Once again, we are available on call to ensure that there's no delay in getting product to patients, and sometimes there may be necessary discussion on the phone with the on-call physicians. So once again, this is a part 2 of a Manitoba-wide stewardship program, which is looking at appropriate use of blood products and plasma proteins. And we're hoping this new process change will continue to provide this valuable resource for patients that require it, and that in the event of potential shortages in the future, we are able to screen requests much more efficiently and appropriately. That concludes the short video. Please, if you have questions related to the process, you can reach out to one of the outlined people on the team, and we'll be happy to engage you and troubleshoot with your particular service as how to improve the flow of the product and the information.